Today's topic is not only important, but also a real health warning that could save your life. When it comes to senior health, we often think of vitamins as a good thing. But that's not always the case. In this video, we'll talk to you about a vitamin that can negatively affect brain function and even increase the risk of stroke, a stroke. As a neurologist, I've seen many cases of excessive consumption of this vitamin seriously affecting brain health. This risk is especially high in people over 60. What is a stroke and why is it dangerous? A stroke is a condition in which blood flow to the brain stops, causing brain tissue to die from lack of oxygen. This is a serious condition, sometimes life-threatening, and sometimes disabling for life. Can lower. Every year, about 800,000 people in the United States have a stroke, and most of them are people over 60. As we age, blood circulation slows down, blood vessels lose elasticity, and cholesterol and sugar levels increase. On top of this, some vitamins that we think are beneficial but consume in excess can dramatically increase the risk of stroke. Dangerous vitamin, vitamin E. This is unexpected information for many. Because vitamin E is often known as an antioxidant. However, studies show that high doses of vitamin E, especially in synthetic, artificially prepared, form, can cause excessive blood thinning. Vitamin E fights blood clotting, that is, it is a natural anticoagulant. However, if it enters the body in excess of the required dose, especially when taken with other drugs, such as aspirin or blood thinners, this can lead to stroke. This is especially dangerous for the elderly. Clinical studies result. A 2005 study by the American Heart Association found that doses of vitamin E above 400 IU increase the risk of stroke by 22% in patients over 60 years of age. Other studies have confirmed this. In what cases is vitamin E dangerous? When taken with regular blood-thinning drugs, for example, warfarin, aspirin, in people with high blood pressure, people with heart or vascular disease, in patients with cerebral circulation problems. How can you safely consume vitamin E? First of all, it is recommended to get vitamin E from natural sources: nuts, almonds, peanuts, sunflower seeds, spinach, broccoli, avocados, whole grain breads. Before taking any diet or vitamin supplements, you should consult a doctor. Natural food products should be preferred over synthetic vitamins. Vitamins and stroke, other dangerous combinations. Along with vitamin E, excessive doses of vitamin A can also increase blood pressure and increase circulatory problems. Especially if not combined with a healthy diet, these vitamins disrupt the body's balance. Vitamin C can also sometimes cause unexpected reactions in the cardiovascular system when consumed in excess. Therefore, it is very important to maintain moderation in the dosage of any vitamin. Plant-based omega-3, flaxseed oil, chia seeds, natural antioxidants, berries, ginger, green tea, healthy fats that improve heart and brain function, olive oil, avocado. What doctors recommend. I recommend that people over 60 years of age introduce the following healthy habits every day. Increase physical activity. Walk for 20 to 30 minutes a day. Prefer natural food. Drink enough water. Do not take supplements without a doctor's supervision. Try to get vitamins only from natural sources. Further explanation. Why is this problem so common? Elderly people often take vitamins based on advertisements or recommendations on the internet. Any drug taken without a doctor's recommendation can be dangerous to health. This is especially important for people taking several types of medications. For example, mixing vitamins with heart medications, blood pressure medications, or anti-diabetic drugs can lead to toxic effects. Choose natural sources. You can safely get vitamin E from the following foods: almonds, spinach, sunflower seeds, olive oil, avocado, oats. By consuming a small amount of these foods every day, you can reduce your risk of stroke and improve your heart and brain health. Medical examples. In many clinical cases, stroke patients have reported taking too many vitamin supplements. They thought they were getting benefits, but in reality they were harming their health. Vitamins are a powerful tool. Not knowing how much and where to get them is the biggest mistake. This issue is especially serious for people over 60. Therefore, remember the advice given in this video and protect your life with conscious decisions. Vitamins are necessary, but consciously. Vitamin E is a dangerous substance that is considered the most useful, but if taken incorrectly, can lead to a stroke. Choose natural sources, avoid artificial vitamins, and always remember to consult a doctor. Listen to your body. Monitor yourself every day. If you have the following symptoms, be careful: fatigue, dizziness, dark spots before your eyes, changes in blood pressure, sleep disorders. These symptoms may indicate an improper intake of vitamins. Consult a doctor. In old age, every medicine, every vitamin is a test for your body. Vitamin E is useful, but if used incorrectly, it is dangerous. Regularly analyze your health, choose natural food, and do not take any supplements without medical supervision. Conscious decision, healthy life. The best way to maintain a safe level of vitamin E is to take it in the right dosage, get it from natural sources, and constantly monitor it. Healthy aging is not a miracle, it is small but correct steps every day. Share this video, like, and stay tuned. The most important health tips are ahead. Don't forget to subscribe. The best investment in your health starts here.